Hello, dear friends. In this video, we will talk about our children's depression and how we can figure it out. And so, child depression. Unraveling baby masks. Often when we hear the word depression, we imagine an adult in deep sadness with gloomy thoughts. However, it rarely occurs to us that children can be subjected to this condition. The imagination of many forms an image of an individual between 20 and 50 years old, experiencing hopelessness and lack of energy to live. Children, however, are no exception. From school children to elementary students, they too can hide depressive moods behind childish masks. This article will help you realize that kids are also prone to depression and will reveal certain masks behind which they may hide their emotions. Childhood is often associated with joy and ease, and we rarely associate it with depression. However, statistics are inexorable. About 2% of children in Russia face this illness. We must be careful, because the correct diagnosis is not always made, and there may be more signs than we think. Recognizing childhood depression. Hidden signs you can't miss. Often the masks of childhood depression go unnoticed because its manifestations don't seem to be directly related to sadness. In this article, we'll look at how to recognize childhood depression and understand what's behind the various masks. Child psychologists say that the boundary between childhood and adolescence passes at the age of 12. Unlike adolescents, in whom depression often expresses itself in a similar way to adult depression, in children it takes the form of hidden masks expressed in unexpected behavioral reactions. Children's depression often masquerades as irritability, anger, and conflict, making it difficult to discern. A depressed child may not appear sad, but rather irritable, causing misunderstanding in others. One sign may be a deterioration in school performance. A child facing depression may have difficulty concentrating and memorizing material, which affects his grades. It is necessary to remember that depression can be the main cause of problems in learning. And instead of accusations of laziness, it is worth paying attention to possible emotional difficulties. Another signal of childhood depression is complaints of various pains. A child experiencing a depressive state may physically manifest their tension through pain in various parts of the body. It is important to respond carefully to these signals without ignoring them, to avoid further worsening the child's condition. Signs of childhood depression. Fluctuating mood and aggressive behavior. Childhood depression can manifest itself not only by constant sadness, but also by a changeable mood. A child suffering from this condition may experience mood swings and their behavior may seem maladaptive. Familiarize yourself with the possible signs to understand what may be behind this weirdness. Mood swings. Children with depression may exhibit mood swings. Your child may have been happy and active, but suddenly become angry, tearful, or resentful. This mood change is not always due to external circumstances, and those around the child may have difficulty understanding what is going on with the child. This fickleness may be a reaction to internal emotional difficulties that the child cannot cope with. Aggressive behavior. A child who is depressed may experience anger and direct it at both themselves and others. This aggressive behavior may manifest itself in conflicts, physical fights, or even self-harm. It is important to recognize that aggressive behaviors play a role for the child in helping them cope with their emotions. Prohibiting these behaviors without providing alternative strategies can lead to a recurrence of the behavior. Adult support includes not only prohibiting unwanted behavior, but also teaching children alternative strategies for managing emotions. Open dialogue, understanding, and a willingness to help the child learn emotional skills play an important role in combating childhood depression. How to help your child fight depression. Advice for childhood depression can be difficult to recognize, but active parental intervention can make a big difference. Here are some steps you can take to help your child if you notice troubling symptoms. 1. Don't ignore changes in behavior. If you notice that your child's behavior has changed and you also observe the described symptoms of depression, don't ignore these changes. This could be a sign of depression and it is important to intervene. 2. Communicate with your child. Talk to your child and show interest in his feelings and experiences. He or she may have issues that he or she is not talking about. Open dialogue can help you understand what is going on. 3. Seek professional help. If depression is suspected, see a child psychiatrist or therapist. Depression can be successfully treated with a variety of methods, and a professional will determine the best course of treatment. 4. Don't blame yourself. It is important to realize that depression should be diagnosed by a professional. Do not blame yourself if you discover that your child is depressed. This does not mean you are a bad parent. Early detection and treatment are important in restoring your child's health. 5. Participate in treatment. If a diagnosis is made, partner with professionals in your child's treatment. Your support, love, and participation are key in helping your child regain his or her health. Remember that you are not alone and support is available. On our channel, Practical Psychologist, Mr.Gun Masks of Child Depression subscribers will be able to familiarize themselves with the main advanced methods of practical psychology, get advice related to the upbringing of children of different ages. Don't forget to subscribe to the channel and mark your visit with a like. Thank you.